pathophysiologic pieces of aging, like the barrier. So the barrier has parts of our skin that are changing as we age, no matter what we do. But in reality, as we age, all these systems are playing together, and they've been playing together for decades. There are elements that we don't like, but in other ways, there's things that we really love about aging. Our understanding of aging and how it influences these diseases has grown tremendously.
Welcome to Derm-It Trotter, Don't Swear About Skincare, where host Dr. Shannon C. Trotter, a board-certified dermatologist, sits down with fellow dermatologists and skincare experts to separate fact from fiction and simplify skincare. Let's get started.
Welcome to the Derm-It Trotter, Don't Swear About Skincare podcast. Today on the program, we've got Dr. Dan Butler. He's a board-certified dermatologist, and he directs the Inflammatory and Aging Skin Research Program at the University of Arizona. Translation, he's a dermatologist that specializes in our skin as we tend to get into those older years. Welcome to the podcast, Dan. It's great to have you here.
Thanks so much, Shannon. It's great to be here with you.
Well, I think, aging is something that's on everyone's mind, right? We see the ads, we're bombarded every day. We always talk about anti-aging. Now the anti is getting crossed out. People are talking more about longevity medicine, living healthier lives, and really talking about health span and how well those later years kind of go for all of us. And skin's no exception. But I wanted to kind of have you set the background for us and talk more about what just happens sort of naturally, if you will, in our skin as we age, because there are some things that we know just are definitely going to occur, even though we might try to work against them a little bit.
Absolutely. And you hit the nail on the head, which is, dermatology has a complex relationship with aging. We simultaneously see a lot of aging patients, and we do a lot of anti-aging cosmetic work. And so it's a fun duality, and that's what makes me interested in it. But to your question, there's a lot of things that are happening, and I love the skin and aging together because you basically get a window into aging by looking at the skin. So, the way that I like to think about aging skin is you have intrinsic aging and you have extrinsic aging. So what I mean by that is it's the things that happen to us from the outside, and then there's things that are just naturally happening within our body. Mm-hmm. So some of the same things are targeted, things like elastin, things like collagen. These are foundational scaffolding pieces of our skin that as we age intrinsically, they just don't produce as well. And then also they're affected by the sun. So one of our outside environmental pieces is trying to damage these all the time, which is why us dermatologists are talking about sun protection all the time. So this can be extrapolated into many different of the pathophysiologic pieces of aging, like the barrier. So the barrier has parts of our skin that are changing as we age, no matter what we do, but also the extrinsic environment, pollutants, sun, chemicals, all these things can change our barrier as we age. So I could go on, but if you look at it from an intrinsic and an extrinsic perspective, that's really how we start to look at these elements of aging in our skin.
And we have dual forces then when you're talking about sort of that intrinsic and extrinsic type forces that are working against us. Do we see variabilities more on the intrinsic side? I know you mentioned obviously from an extrinsic ultraviolet light and how it can affect us, but do genetics play a role, or have they noticed any differences in how people might age differently in regards to skin? And maybe the research hasn't been done in different parts of the world.
Yeah, no, well, first and foremost, not enough research has been done. So anyone who's interested and want to get their palate wet on aging skin, go for it. And there's a lot of different applications. I will say you hit the nail on the head again, which is the intrinsic aging processes of the skin is probably where we know the least. And that's because a lot of the cosmetics companies have gone to the extrinsic aging. They're trying to reverse some of that. But we don't know as much from the intrinsic side. But you're absolutely right. It's some of the more common players. It's things like genetics. Genetics really hit on things like the immune system. And we can talk more about the immune system, but the immune system intrinsically ages. The extrinsic world can also affect it, but intrinsic aging is a huge part of how our skin ages. And, intrinsic immune changes are a big part of how our immune system is influenced as we age. And that creates a lot of the things that we see. It creates a propensity for certain skin cancers. It presents as different common symptoms we see, like pruritus. So you're totally right, but I don't have all the answers for all the intrinsic things that happen as we age.
Well, I think one of the things people talk about when you just mention all those changes, skin, obviously patients come in, they've noticed over time, like, oh my gosh, my skin is just changing dramatically. And I feel like sometimes it's this light bulb moment that even as early as in our 40s, midway for most of us, if we're going to live, to that average lifespan, especially for women, that all of a sudden they're appreciating these changes, whether it might be fine lines or wrinkles or brown spots that are starting to pop up in that area. And then I think it's, shocking to people to realize, gosh, my skin's aging just like my internal organs. And I love to tell people, yep, you just don't have to watch. You get to see it in all its glory as the skin starts to change over time. And when people come in now, especially, I feel like my older patients, one of the most common things I have to deal with is itchy skin. You mentioned pruritus or itchy skin. And I think people out there are just wondering, why as I get older, am I itching more? And even for some of our dermatology listeners, why is itch so predominant as the skin ages? Is this the immune system at play, potentially other factors? And how do you like to explain that to patients and help them through the process of getting that itch under control?
It's such a good question. I love it. And I'm spending a career trying to figure out how to explain it. Well, first and foremost, you set the table beautifully, and all listeners should know that itch is the most common reason that someone sees a dermatologist over the age of 50. And 50 is not old. And then you also hit on another thing of aging that I think is really important, which is the incidence of itching starts to increase sharply at age 40. It's very low. And then at age 40, if you look at demographic studies and epidemiologic studies, it starts to go up. So that tells and validates exactly what you're saying, the story that, aging starts at 40.
You just depressed a bunch of us out there. You realize that, Dan.
Hey, I'm right there with you. But hey, I think it's, there's parts of aging that we love too. So as back to the question about pruritus, I think there's a lot to it. There's a lot to the pruritus story, but it starts with a three-pronged approach, which is the immune system, the nervous system, and the barrier. And it's never one single one of those. It's always a mix of them. And I think that's often where providers have had a hard time really capturing this, because derm residents, for example, they are really good at trying to split these up. They'll say, okay, itch, no rash. Then I know exactly the test that I have to order for that patient. Or if there is a rash, they know that part of the immune system, the Th2 immune system, is the cause. But in reality, as we age, all these systems are playing together, and they've been playing together for decades. And so what happens is you get a little bit of an immune system overactivation, and that trains the nerves to start to overreact as well. And then what that does is it ultimately creates a barrier dysfunction. That's one way that you see chronic atopics chronically itch. You also have people who have poor barriers. This is the same story with some of these patients with eczema for a variety of reasons, or someone with chronic hand dermatitis who's been washing their hands. Their barrier gets disrupted over and over again. That creates an immune reaction, which then elicits a nerve response. And now you see how these systems are activated. So for anybody who's treating these patients, try to think of it that it's not just one system that's faulty, that there's actually an interplay of three really, really important, delicate, complex systems. And that's why it's so common, because it's not just one thing.
And for patients that are kind of listening, and trying to figure out more about it, I think what you did too is sort of normalize this, right? Because a lot of them think they may be crazy, especially if they don't have itching and they're coming in, try to say, hey, this is debilitating, I can't sleep, or I can't function. So I think letting people know this is extremely common, like you mentioned, is important to highlight. And it's something that we can address and treat effectively for them. And I think shifting a little bit from that, but also commenting on the itching, probably one of the more common things that I have patients talk a lot about, is the bruising or purpura, as we call it, that they tend to see on the arms and the legs that formerly used to be referred to as senile purpura, kind of insulting, I know, and we've sort of changed that. And I remember back in the day when that was still the term, I tell my patients now, please don't be offended, but this is actually what they call it. And I would typically say purpura, and sometimes we joke about the senile part. I said, this is no way suggests that you are senile. I said, it's kind of an inappropriate term that's fallen out of favor. Can you talk about, why this happens? Because if patients come in, they have this bruising and they're utterly frustrated, right? I think sometimes can be dismissive, it's just bruising, but for some of them, they won't wear short sleeve shirts. I had one that she said, I feel like people think my husband beats me and I don't want to be out in public because I'm worried what people will think about me, or they'll think that I have an underlying serious illness, maybe like cancer. And I don't have that going. I don't want people asking me because, I look like I bruise so terribly. So I was going to have you address that because I know it's one of the most common things that people are concerned with.
Yeah, and I'm glad you're bringing it up because so many people ask about it. And I wish I had the answer for it. And if you and I come up with it, we'll be billionaires. But again, we'll activate, we'll activate, whatever researcher is listening to this podcast who wants to study it. So it really is a major problem. And I love that you talked about the use of senile as a proxy for aging. I think it gets to a core piece of our sort of dismissiveness of aging in some ways. And so I'm glad that we're starting to replace the use of senile with, just aging. This is not associated with senility by any means. This is just an element of aging. And there's very strong pathophysiology around it. So if you look at a purpura related to aging, it's almost exclusively in sun-related areas and areas where there's already thinner skin. So you're looking typically at your forearms and your legs. And the reason why you start to get purpura in these areas is back to that story of the scaffolding in our skin. Elastin, collagen, those are like the cement around a tunnel. So when we're young, the cement around a tunnel is strong. It keeps that vessel protected. If something pushes it to the side, that cement's going to keep it there. But as we age, as intrinsic processes take shape, as the sun hits the skin and hits that dermal elastin and that dermal collagen, that cement around the vessel starts to weaken. And so that vessel can shift. And so as that shifting happens, you can have it where just a light trauma shifts that vessel. Or you can even see it where just sheer force, someone gets bumped, it's not even in that area, that scaffolding can just cause a fracture in that vessel and it starts to create that purpura. And it's really distressing for people. And so the two things that you want to talk about with people is, look, this is directly related to sun exposure, not in a blame game, but explaining that this is not something that's faulty intrinsically all over their body. This is just in areas of typical sun exposure. And it's actually reflective of natural processes in the body. And it is not dangerous and not reflective, again, that this is happening in the kidneys or the liver, or like your patient mentioned, that it's reflective of some sort of deeper pathophysiology like a cancer. Mm-hmm. So those are really important pieces to explain because it's very stressful for people.
Now, after you've gone through that explaining, because I think the next big question, of course, I always get asked, well, what do I do about it, right? Like, is there anything I can do to prevent it? Or once it arises, there are some over-the-counter products that are touted a little bit to kind of help hasten the resolution of it. Do you feel like there's anything worthwhile recommending for prevention or on the treatment side?
Yes to both. I don't think there is an eraser. I think obviously, Shannon, you know that, but for those listening, unfortunately, I don't have the eraser. You want to make sure to stress sun protection. This is a long game. So even if you're getting it now at age 65, 75, 85, we're still hoping that this can improve in 1, 2, 5, 10 years. So continued sun protection, continued barrier support. So that's with a really good moisturizer. And then the other thing that has some data is retinoids. So retinoids do have some pretty decent data to be used. They do help with collagen remodeling. And so I do have a number of patients with this purpura related to aging who are using retinoids on their skin, both OTC and prescription. So that's typically where I start. And I think it's a reasonable starting place for most people.
So sun protection, over the counter, or even prescription retinol lotion or cream to put on those areas. What about if you've already got it and you're trying to get it to go away quicker? There are some available products on the market like Derm-It and things like that. Have you seen improvement for some patients with things like that, or feel like overall, they don't make much of a clinical difference to get those spots to go away?
No, absolutely. I've seen improvement, and again, I think some of the magic or the mystery is that these are things that we don't have head to head studies to
Hmm.
compare. But I always encourage patients that, hey, if you're struggling with this, there are plenty of options out there. Now, I'm not going to send you on a wild goose chase to spend thousands of dollars on them, but I think it's worthwhile to try some of these OTC products that have some control or strengthening of the vessels or control of some of the bleeding once it's happened. And I've seen really good results. I wouldn't say there's one that overwhelms me over the others. So I usually say, hey, do a self experiment, buy one that sounds good that you've gotten recommended from a friend, and start there.
Are there any in particular, and you're okay to mention names here, that you personally recommend to patients that over the counter that you would say try this if you are dealing with purpura like this?
Yeah, so I work for this company because I really really like their product. So True Botanicals has a really good OTC retinol alternative that works really well for my family members. So I don't mention it in clinic because I don't want to have a conflict of interest. But if you say
Sure.
that I can mention it here, then
You can. You
they're
disclosed
they're
it. Yeah,
they're
people are
they're, they're
looking
a
for those
good group.
resources. Perfect. All right, you guys heard it here. All right. So, once we kind of think about, yes, the itching, I feel like, definitely purpura, patients come in, they complain a lot about that, like, gosh, this just drives me crazy. The other thing that I think deserves some attention is just looking at skincare, right? We talk about not trying to pigeonhole people with skincare necessarily according to age to a degree, but we also know that at different points in our life, we have unique skin needs, where we might need to adjust sort of what we're doing just based on where we're at. And that could be individual based on other factors too, like genetics or how much ultraviolet light exposure for a smoker. But if you're talking to a patient who, kind of is fitting in that older age group about what we should do for regular skincare, are there certain things that you tend to highlight that are more important than others? Or again, you can recommend if there's particular products, because I think a lot of people want to know what should I be doing for my skin, as I'm maturing.
Yeah. I love that. And I love the phrasing that you use there, Shannon, with maturing. That's the absolute right way to phrase it. And, I think you said this right off the bat, which was normalizing the process. I think a lot of people, particularly when it comes to how they communicate with the world, which is their skin,
Hmm.
they feel deeply personal about it. And sometimes they don't really have a place to talk about it. And so they'll come to their dermatologist to say, hey, I don't feel great about, where I am in my overall health, and that's reflected in my skin. So making sure that everyone knows that we're all aging, and aging, no matter what you see on, People Magazine or on TV, like it's happening.
Hmm.
And then I always like to sneak in that, aging is in some ways, there are elements that we don't like, but in other ways, there's things that we really love about aging, which is like experience, wisdom, time, relationships. All those are really wonderful. And it takes 2 seconds to emphasize that in a room. Hey, you are, I totally understand where your skin is making you suffer right now. I'm so glad, though, that we're getting to have this meeting and I'm getting to talk with you, because aging is something that we can hold at the same time, the experiences and relationships and time, but also trying to reverse some of the things that we don't like. That's literally the script that I'll use. So once I've normalized that, then I go into making sure that I'm not under treating somebody. And this is a huge problem in geriatrics, because in
Hmm.
traditional medical education, treating older adults is about, limiting everything that they can have, like don't overtreat them, don't give them
Hmm.
too many medications,
Right.
deprescribe. And in some ways we need to do that. And in other ways, sometimes we need to listen and say, hey, is that wrinkle really bothering you?
Hmm.
And if it is, like, let's talk about it, because that's one of the unique things that we can help them with. So anyway, long story short is making sure that you're listening to what's impairing their quality of life. From there, I go into understanding someone's skincare routine when they're asking me about that specifically. Hey, if I just want sort of a glow up on my skincare routine, what does that look like for me? And I usually recommend that they have two elements of their skincare routine. Number one is the luxury of it. Usually people like the luxury of a skincare routine. That means, hey, I'm going to treat myself really nicely here. And I'm going to actually pretend like my skin is as important to me as I think it is. And so that means spending a little bit more money or getting the thing that has been recommended. And so when I'm hearing things like that from a patient, I'll say, hey, look, that is an important part of your skincare routine. Treat yourself nicely and do that. That's the less practical side. Then I'll move to the practical approach, which is pretty simple. And we already talked about it from the purpura standpoint. But number one is get a really good sunscreen. Make sure that you have a sunscreen that you're willing to wear all the time. That's a really important piece for now and for the long term. Number two is I almost always recommend a retinoid. So retinoids, legacy product. If someone isn't tolerating them, there are retinoid alternatives. I already mentioned the one from True Botanicals. Again, conflict of interest there, but it's a non-irritating retinol product that really helps with collagen remodeling. And then the last thing that I'll have on any skincare regimen is some sort of antioxidant. I think the lowest yield one that is everywhere is vitamin C. I really like a nice vitamin C serum to add to that. But those three would be my practical approach. But I try never to neglect the kindness to oneself. It's like getting a massage. Are you able to go out and run a race the next day? No, it's not going to completely remodel you. But a massage is a way of treating yourself nicely. And I think as we age, we need to think of our skin both from a practical standpoint and from a luxurious treating ourselves nicely standpoint as well.
I like how you point out in the beginning, asking about quality of life, because that's what's so important, I think, for all of us, no matter when we're in our younger years or for our quality of life as we all tend to age. It's going to happen to all of us inevitably. So about the wrinkle and how much it bothers you, because I'll have patients come in, they'll say, I'm kind of concerned about these brown spots or these wrinkles, but I guess at my age I shouldn't be. And should I? And they actually ask me for reassurance. And I tell them, you know what? Age doesn't matter to me. Your number or how old you are does not matter. I said, what matters is if that truly bothers you. And then we can talk about what your options might be. Because I agree with you. I think we can be dismissive. We tend to recommend or undertreat. And I do think there's a little ageism or bias in how we approach our older patients sometimes, especially in regards to things like that we sort of diminish because we just make these assumptions that as we get older, those things shouldn't bother us. And for some people, there's still major concerns that they need to be addressed, and they still deserve our time and attention. So I think you do a great job of highlighting that, because I think we're all guilty of that to some level, even if we don't realize it at the time. And it's funny how even the patient kind of, just culturally how we're trained that the patient, I remember when one of my patients came in recently, she said, I shouldn't bother me because of my age, right? Or I shouldn't worry about it because of my age. It's ingrained in us to that point that she was dismissing her own concern that clearly bothered her. So really good thing that you highlight there. In our last few minutes, I kind of wanted to get your thoughts on, where the future's going for this area of what we're calling now more, if you will, elder dermatology, where we almost feel like folks like yourselves are specializing in taking care of our aging population. Regardless if they specialize or not, as you know, the average dermatologist is going to be taking care of this population. Our population is shifting. We have dropping birth rates. We have the baby boomers as they're coming in, to this era of their life, that this is a lot of who we're going to take care of. But I wanted to get your thoughts on maybe where the future is going to be for dermatology and skincare and helping our older patient population.
Well, I love the question, and I totally credit you, Shannon, for bringing this topic up. It's a really important one. I think it's on all of our minds because the truth is, the future is we're all aging. No matter what we do, no matter how many lasers or skincare routines we try, like it's coming. So be ready for it, whether it's personal or with your patients. I think there's so many different directions to go to answer this question. Some of them are, abundantly basic. Like, how do we make sure that some of our novel medications that pertain to conditions of older adults, how do we make sure that those medications are tested and accessible for older adults? Like, that's very basic. If you're on Medicare, how can we get you the medications that you need? So there's a future there. There's also a future in understanding the pathophysiology of aging diseases in dermatology. So, why is the most common population to get atopic dermatitis after adolescence older adults? Why is a niche disease like pyoderma gangrenosum, which is a chronic ulcer, why is the most common population to get that older adults? So I think there's a lot of our understanding, and I will tell you, over the last 10 years, our understanding of aging and how it influences these diseases has grown tremendously. We're understanding, how the immune system, how the barrier, how the nerves, how fibroblasts are all influenced intrinsically and extrinsically. And again, I could talk about that for days, but understanding our diseases. And then from a skincare standpoint, I since I've been in dermatology, which has just been about 15 years, the explosion of skincare and the science behind the skincare is remarkable. And so I think, I'm hopeful, but I do think that our understanding of the pathophysiology of diseases in aging are going to allow us to bring that into the OTC skincare world to combat some of these minor effects of aging. I say minor because they may have a huge impact on quality of life, but things like changes in collagen, things like a change in elastin, things like subtle immune changes, which can present in the worst ways as diseases of aging, they also present in minor ways day to day that we can influence from a skin perspective. So I think we're ultimately going to be able to take what we're learning from the diseases and bring it into the skincare world to use it as prevention, or at least arresting some of these burdensome and quality of life impairing effects that we often see. But that's a hopeful take. I'm an optimist, so that's always where I sit, and I'll spend my whole career trying to figure it out.
Hey, I love that. And it's so exciting we have people like yourselves dedicated to figuring this out, because, aging does take on, for most of us, this negative connotation. And if we can bring that hope and light to it, that we can age well and have great health and quality of life through that aging process that we're all, destined to be a part of, I think that's just a wonderful mix and compromise for it all. It'd be perfect. Well, thank you so much, Dan, for coming on the podcast. This is a great overview of kind of where we're headed, where we've been, and some great recommendations for our patients. And stay tuned for the next episode of Derm-It Trotter, Don't Swear About Skincare.
Thanks for listening to Derm-It Trotter. For more about skincare, visit dermittrotter.com. Don't forget to subscribe, leave a review, and share this podcast with anyone who needs a little skincare sanity. Until next time, stay skin smart.